This program on investing under regulation crowdfunding is not investment advice.
Rising with the crowd, power unbound, change makers lead where hope is found. Superpowers for good, shaping the fate. Investors and dreamers open the gate. Supercross stands loud, proud and true, building tomorrow for me and you.
Have you ever thought that it would be great if there were a better, faster, less toxic way to get imaging when you're in the hospital? You ever thought, here I am sick or injured and they're filling me full of radiation that can't be good? Well, our guest today has figured this out, and there's an opportunity for you to invest as well. Please stick around. You don't want to miss this episode. Now, welcome to the Super Crowd Presents Superpowers for Good. I'm your host, Devin Thorpe, and our guest today is Cristian Atria. He is the CEO and founder of nView Medical. It's really pretty amazing what he's done. You don't want to miss this episode. Cristian, welcome to the show.
Well, thank you for having me and for the opportunity to be here with you.
Well, the privilege and pleasure is all ours. Tell us about nView Medical and the technology you've created and why and how it's different and better.
Sure. So nView Medical is a surgical imaging company. So we've developed actually a surgical scanner, which you see behind me. And what we've done is a system that can be used during surgery so that the surgeons can see what they're doing in 3D. And the challenge with 3D is that it creates a lot of radiation. So we've created a new way to create images very fast in 3D, and the surgeon then has the benefit of having 3D visualization, which leads to more accurate surgeries without the cost of having to radiate the patient. So here you can see, and basically this technology is being used in pediatric surgeries right now for spine and orthopedic procedures. So whenever a kid, for example, has broken bones or needs to go through a spine surgery, the challenge is that the surgeon has to do those complex procedures, and obviously we want to protect those kids with less radiation. So this is the technology that basically, if you're familiar with a CT scan, you would imagine you're in a bore inside this tube and it takes minutes to get a 3D image. We basically developed something that gives you just a spot of imaging time, and during that spot of imaging time, we're able to create a 3D image as if it was a CT scan for diagnostics. But then it's just a few seconds, and because it's so fast, then it can be used during surgery to help the surgeon as he's doing the procedure itself.
That is amazing. You can think there's an almost infinite range of applications for that. And nobody, children or grown-ups, want to have that extra radiation if we can avoid it. So this is really important technology. And now, Cristian, I don't think we're talking about an idea, a concept, or something even that's waiting for regulatory approval. You have these devices available for sale today, right?
Absolutely. This is a technology we've developed in the last 10 years, and we've been commercial in the last couple of years, and is actually being used clinically. So we have customers that are using this technology routinely. We decided to start and bring this technology in pediatrics first, because it's the population that requires more protection with respect to radiation. But as you said, this technology can be used across the whole spectrum of population, and also there's a whole spectrum of procedures where this technology can be used.
It's really wonderful that this is so cool and doing so much good in the world. As you think about this technology and the application, you've actually raised a lot of money to get to this point. Obviously, you don't bring something like this to market on a shoestring budget. you've raised grant money, venture capital, angel rounds. You've done it all. What leads you to choose to do a StartEngine round with under regulation crowdfunding?
Yeah, so we were fortunate when we started the company to have grants. We had grants from the National Science Foundation and the NIH. And this is really what funded the basic science of this type of imaging, which leverages AI and very advanced computing technologies to be able to do what we do. And then after that, we had angels, as you mentioned. We had a VC round that they led our seed round, and then we had follow up, including from strategics. And we went commercial, and we went commercial for a technology like this very early, in the sense that we were able to have a prototype that was good enough for clinical use, and we got regulatory approvals relatively early. So we were able to put this in the hand of clinicians, and we went very fast into the commercial world. And once we started commercializing, we felt that we could have done a VC round and go with a very large round, but of course, there is a lot of equity and dilution that goes with that, and that would have kind of brought the company in a trajectory that would have been very aggressive. And we felt that the right strategy for us was to actually bring the community around us and use that round to complement the funding that we had, and also the revenue that we're generating already with our existing customers.
It is just exciting to think about the opportunity for ordinary folks, everyday investors, to participate in something of this quality. It's very exciting, and to think about the health impacts as well. This isn't just the newest and best. It's better for people, and that's exciting to think about. Take us back now. Let's think a little bit about the history. Where did this idea develop from? This is really challenging technology. This is not the kind of thing that you wake up one night and out of the blue sort of tackle. Where did this come from?
Well, I did most of my career as an engineer with General Electric, and of course they are the market leader in CT scanners and X-ray imaging systems and MRIs and so on. So I've been involved in this space for many years. I had a pretty interesting role with them. I was general manager in the space of surgical navigation. So I was developing technologies to help surgeons basically use imaging. So obviously I had the background. I knew that there was the need to have an efficient way to create 3D images. And I knew that radiation was, of course, always a challenge. So the need was very clear when I started nView. And when I started, it was at the beginning of GPU computing. And when I saw what the GPUs could do, and there was AI, but it was more GPU computing at the time, it was like, wow, there is really the opportunity here to change the way we create those imaging systems and really build something different and really address those needs in a different way. And that's how I convinced myself to leave corporate America and start my own business.
That's brilliant. That's brilliant. As you think about this technology, it seems to me, as a non-expert lay person, if you will, that this is a big market, that imaging is something that generates billions of dollars a year in revenue, and this has wide application in that context. How big do you think the market is for your technology?
I mean, this is definitely, imaging is everywhere. If you go in hospitals, you will see, there is a whole department that just does imaging, right? With, any hospital in the US has multiple CT scans and MRIs. And through the hallways, you're going to see equipment similar to what you see behind me, with plenty of, dozens of imaging systems like this. So In terms of dollars, I think if you combine diagnostics imaging with interventional imaging, it's north of $10 billion of market size, the total addressable market for technologies like this. Now, of course, we're a startup, still a small team, a small company. So our approach has been to look at this large market and find a beachhead, basically a small application where we can really show how this technology works and really show the benefits of this technology in the real clinical setting. And that beachhead market for us was pediatric surgical imaging. So that's what we're focusing on now commercially. But obviously, part of this raise and our future plans are to expand the applications so that we can gather, reach more of that market, and of course, make more patients benefit from this technology.
It is exciting to think about the potential scale of this business. You've got a small team today, but it's easy to envision working with a lot of people, and even to get a call from one of your old colleagues at General Electric saying, "Hey, I think we need to talk about potentially becoming part of General Electric," plus all the other folks that play in this space. So it's a very exciting investment opportunity, it looks like to me. Of course, I want to encourage our audience to be thoughtful. Do your due diligence as you take a look at this. But boy, this certainly seems like one that is worth spending a few minutes to investigate at least. So visit s4g.biz/nview to visit the StartEngine page. That'll just redirect you there and give you a quick way to learn more about this incredible investment opportunity. Cristian, we've got to take a quick break, if you'll forgive me. But folks, I'm really fortunate today to have an incredible guest, Cristian Atria. He's the CEO and founder of nView Medical, and he's got an amazing technology that allows for instant 3D imaging that really is a huge step forward in imaging that will reduce the radiation exposure of conventional imaging, as well as simultaneously allowing surgeons, especially, to have an instant image, an instant 3D image to improve their surgical outcomes. So, great technology, very exciting. Raising capital and StartEngine. Listen, we're going to take a break, but when we come back, we're going to talk to Cristian about his superpower. So stick around. You don't want to miss this.
Download a free copy of How to Make Money with Impact Crowdfunding, the book Sarah Hanks describes as
a fantastic overview, not just of crowdfunding investing, but of investing in general.
Andrew Savickas raved,
"This book offers unparalleled insights for anyone looking to make a difference."
Scan the QR code to get your copy. SuperCrowd 25, where innovation meets impact.
18 hours of live content, 5 platforms, 1 global audience.
Join the largest event for regulated investment crowdfunding. Live pitches, expert panels, real change.
August 21st and 22nd.
Scan the code or visit thesupercrowd25.com to register free today.
Struggling to raise capital for your business? Unlock the power of the crowd with AI. My free guide, Crowdfunding Made Simple, walks you through every step to success. Get funded smarter, faster. Scan the QR code now for your free download.
Welcome back. Folks, I just am having so much fun today talking to Cristian Atria. He's the CEO and founder of nView Medical. This is a 3D imaging technology company that has products fully commercialized for sale to hospitals right now, this minute. This is not a dream, it's a reality. This is a very exciting company to be talking about, but we're going to shift gears. I'm going to force myself to shift gears a little bit, talk to Cristian about his superpower. Stick around. Cristian, you are a very impressive guy. just the career you had at General Electric is impressive, but what you've done at nView Medical is almost mind blowing. The level of innovation required to pull that off, your ability to lead a business, to raise capital, grants, angel round, venture capital, now raising capital from the crowd. That takes real skill, real insight. What is your superpower?
Well, I think my superpower is really curiosity and passion for a variety of things that are very different. So really the ability to get passionate about things that don't seem to be connected. And, 1 minute in my everyday work, I can be thinking about medical physics, and the other minute I'm thinking about a surgical application or talking to a surgeon. So really that curiosity and that passion to learn different things and then to connect them together and go back to my background and connect things that I did in the past that seem to have nothing to do with what I do now, and then in the end everything can be connected, and I just love doing that, and I'm very passionate and curious about learning things.
That is a really powerful superpower. Look at what you've done. Look at what you've done. I wonder, nView is a large manifestation of that, but I wonder if you can think of either a subset, a component of that is to serve as a story, a point where you were able to make a leap in the progress by applying that passion and curiosity to a problem or perhaps an experience other than nView where you could share a detail, a story to illustrate your superpower.
I'm going to get you out of nView for a second and talk to you about an experience I had some years back. I'm a father of 3, and I had 2 boys that were born, twin boys that were born premature, and of course challenging times. And I go back home with the boys, and everything's going well, and then we have to go back to the hospital. And one of the boys had difficulty breathing, so he stays at the hospital. And then 1 day passes, 2 days pass, and it gets more difficult, and he's having serious apnea, crises. And at a certain point, we think he's, going to get worse and worse, and we don't know what's going to happen. But through that process, of course, I'm in a new environment, right? I'm talking to clinicians and people that are taking, care and great care of the kids. And I'm asking plenty of questions. I always ask questions in the medical field, try to learn while this is happening. And, because of those questions, I think we created a great relationship. I was able to actually, understand the diagnosis and understand how they were measuring, certain biometrics in my kid. And together we actually were able to realize that we had the wrong diagnosis and we were doing the wrong treatment. And that really came from just this dialogue, right? Just listening to them, talking and explaining what they're doing. And I'm really glad I did that because my kid was really getting worse. So I never felt that I wasted my time asking questions or being curious about something.
That's a great and powerful example. My heavens, that is really a great. Are your children well now?
Oh yeah, now you would see them. They're like 1 feet taller than me and much stronger than me. So they are great. And I remember actually the people at the hospital, they were telling me, it's like, don't worry, they're going to be fine. One day they're going to be, all grown up and you're going to be fine. And it didn't seem true, but yeah, no, I mean, they're doing amazing. They're actually just finishing school now and going to start at the university next year. So we're going to be empty nesting. So.
Wow. Well, congratulations. I'm so glad to hear that they're doing well after you shared that story. I can only imagine how harrowing that is. Only imagine. Now, Cristian, I wonder if you could share some tips for us, to develop curiosity and passion, bring those together to address issues. I think all of us want to be able to do that better, especially in the kinds of moments you are describing with your family. We all want that ability to help solve problems, and sometimes they're really complex, and we feel powerless. But in that kind of context, you found some power in your curiosity, and certainly you felt passion for solving those problems at that point. What tips would you give us to be better able to develop and deploy that curiosity and passion that you're talking about?
I mean, I'd say the first one is to try, right? Sometimes we are a little bit shy. I mean, I'm an introvert, for example, and I have a shy nature. So we don't try. And then once you try once and you have a good dialogue with someone, and you learn something, then it's easier, of course, to continue doing that. Today's you have so many tools around you, right? ChatGPT. I can spend so much time, for example, trying to learn things on the internet or with ChatGPT or other language models like this. There's so many opportunities, right? So definitely use that. And every opportunity is good to learn, whether you're in a social setting or in the hospital, unfortunately, for some reason, or at work, right? At work, you are an expert somewhere. Don't feel too comforted by your expertise, and just get out of your zone of comfort, and it's going to pay out, and it's going to be a good thing for you and for others around you. Don't be scared to fail. Of course, if you're scared to fail, you are going to interact less and not ask those questions, because sometimes they seem like silly questions, but they're not. So those are a few of the tips. Common sense maybe, but is once you start doing them, then it gets easier.
Yeah, as you think about this, I wonder if you could add one tip for us that would relate directly to how one leads a business like yours successfully. Something that you've learned along the way that would help us do that. Again, it's connected to your superpower, that passion, that curiosity. How would we deploy that as leaders?
I mean, what I do, I like to walk around, right? And in every single day is the people that are around me. I sit close to them while I'm working, right? Sit close to them and I say, hey, what's going on today? What are you up to, right? And then they stop what they're doing, whether they're coding or they're developing the product, and they tell me what they're doing. And of course, they are the experts and I'm not. And I ask a few questions, and then we start a dialogue. So this kind of walking around and sitting shoulder to shoulder with people and try to have that dialogue and ask those questions, right? There are a lot of people, especially if you're in a leadership position, you have the tendency to be directive, right? And we have all fallen in that trap of you have to do this, you have to do that. What I've learned also over time is, ask more questions than the ones that you are answering. And if you have that right ratio, then everyone is going to be better off.
Yeah, that's so great. Great tip. Thank you so much. Now, as we wrap up, take a minute and tell people how they can connect with you, especially those folks who may want to put a larger check to work in the business. But how people can connect with you, learn more about you and the business, how they can invest in the StartEngine campaign, maybe where they can follow you on social media, that sort of thing. Give us
Right.
a complete rundown quickly.
All right. Well, for the first one, I would say, obviously, we have the link there. So go to that link. You can s4g.biz/nview. That will bring you to our kind of crowdfunding campaign page, and you can learn a lot of things about the business in there. If you're not necessarily looking to go directly to that page, obviously there is our webpage. It's nviewmed.com. And myself, I'm very active on LinkedIn. So on LinkedIn, Cristian Atria, just you can find my name with my name, you will find me. And this is a small team. I'm totally not unreachable, and I'm really happy when there is curious people that want to learn about what we do. I'm here to answer all the questions. So don't hesitate to get in touch with us.
Well, Christian, thank you so much for taking the time to be with us today. We love what you're doing and recognize the tremendous value, not only to individuals, but really at scale to the population who gets better care with less radiation. Makes a difference in the health of our entire population. Maybe everyone in the world can benefit in the long run from this innovation. It's very exciting. I'm excited to think about the opportunity to invest too, and I want to encourage our audience to check it out. Christian, thank you so much. We wish you well.
Thank you, Devin.
All righty. Now, let's do some good.